हेलो दोस्तों, मैं हूँ डॉक्टर लाल कृष्णा एंड आज हम देखेंगे कि हम प्रीलिम्स के बाद एमबीबीएस की यूटी के लिए कैसे प्रिपेयर करेंगे। तो फर्स्ट एंड फॉरमोस्ट कि सबसे पहले आपको बिलीव करना है कि आप सब पास हो सकते हैं। यू कैन ऑल पास बिकॉज मोस्ट ऑफ यू हैव स्कोर्ड मोर देन 70% इन योर 12th स्टैंडर्ड and have crossed 95 percentile in your NEET exam. So very important that believing that you can pass will make you go through it. ठीक है, then you have to start thinking like a doctor, that you need to have a good purposeful vision of treating and serving needy patients for whom you are becoming a doctor. Then it will be very easy for you to understand the concepts and remember them. So start thinking like a doctor, like you are going to manage patients and treat patients. So to start with, you have to mark all the theory questions and important topics of the previous year if you have not done it already. And if it is possible, you can make notes. It will help you score more because you will be more prepared. Even if you don't make notes, you can pass. But making notes will get you more marks because you will be more prepared to answer the questions. Then if you are reading, just plan what you will be writing in the paper, okay, and make point wise plan that whatever has to be written in the paper, that will help you be more clear and precise. Once you have made a plan, try to discuss it with your friends about whatever topics you have read, you have understood. Try to discuss it with your friends and plan how you will be writing, and tell your friends how you will be writing the topic in the exam. And try to understand how you will be treating the patient. Akka, think like a doctor. Then we have to try and keep revising some topics daily which we have studied earlier, so that the revision part is not left behind. We have to continuously revise at least 1 or 2 topics which we have studied previously, so that in trying to cover new topics we don't miss the older topics which we have read already. Then we have to try to read only specific things which are asked in the question, that whether we are writing a LAQ or SAQ, the previous questions, it will help you in deciding what part is asked. So try to read that specific part and try to memorize it. Do not read extra because you will not be remembering much and you will not be writing that much extra in the exam. So be more specific what is being asked, read that, memorize that and discuss it with your friends. If it is possible, you can make short notes for the last day revision in the form of important words, some diagrams, so that you can revise easily. Then at least try to write 1 or 2 applied points. That is the clinical aspect of the topic. It could be anything, it could be a disease, it could be a treatment which is related. So try to write that. It will fetch you extra marks and help you score much more than normal in the exam. And you don't have to worry because it's just a theory paper like 12th. So keep studying and you will do very well. And if possible, if you have time, you can highlight the headings of the questions, of the answers. That will help you get marks easily. And always try to restrict your time while writing your paper so that you can attempt all the question. Attempting all the question is a very important aspect for passing the paper. If you are leaving some question, there is high chance that it is difficult for you to pass. So always try to attempt all the question by restricting your time for each questions. It should be at least around 12 to 15 minutes for a long question and 5 to 6 minutes for short questions. Then if you have scored more than 50% in your prelims, then you can use some time for your PG preparation. It can be with help of PG notes by various platforms, could be Prep Ladder, Marrow or Cerebellum, etc. Or it could be from PG review books for better marks in MCQs of the university exam, and also it will help us to prepare for the NEET PG or next exam. So any of the platforms PG notes will be helpful. For anatomy PG notes, you can get books by K. Raviraj or Rajesh Kaushal. Textbook, I used to read Vishram Singh. If you are reading something else, please continue that, do not change the textbook now. For physio, you can use Guyton, AK Jain, Sembu, VD Joshi. VD Joshi is the shortest version of the theory book. Then for PG physio, you can read S. Krishnakumar or Somen Manna. For biochemistry, you can go through Satyanarayan or Vasudevan. For PG notes, you can read Rebecca James or Smiley Pruti Pahwa. These are the PG review books. Do not change the textbook at the end moment. Read whatever you have already read, and please try to revise whatever you have read, which is the most important parts. While reading these PG notes or review books, first try to read the topics which are related to previous year IMPs of the university. So previous year important topics or questions have to be finished first, so that you can add some points in your long questions. Also, if you get some MCQ from that topic, it will be better answered. So first finish the topics which are in the previous year topics. Then if you get time, then you can read the rest of the part of the PG notes. Now to topic that how we have to present a paper. Presenting a paper is among the most important aspect of passing MBBS, rather any exam. So the ultimate funda for any theory paper of any exam, which helped me and it will help you definitely, is to make correction easy for your teacher or the examiner, because the teacher will be stressed if your paper is difficult to correct, and you will lose marks. So try making correction easy for your examiner. And how you will be going to do that? We'll start. So try to be crisp, concise and clear. Write whatever is asked, specifically whatever is asked. Writing here and there will not fetch you any more marks. Also, you have to try to avoid writing full sentence. It's not an English grammar exams. It will help you save time and it will also fetch you more marks. Then we'll come for example that blood supply of brain is by anterior cerebral artery, middle cerebral artery and posterior cerebral artery, which arise from circle of Willis. We can write this in a better form as brain's blood supply is dash circle of Willis, arteries will be anterior cerebral, middle cerebral and posterior cerebral. So this will be more clear and better visible, and also it will be time saving, so that you can use your time at the other places wherever it is required. Also, we should try not to write same thing which we have already drawn in the diagram or have you explained it through a flowchart or a cycle. Unless we are out of data, do not write the same thing again. It won't fetch you more marks. So again I will repeat, because it is very important that we have to attempt all question. If it is possible, try to write in good handwriting. It will be more clear and it will give you more marks. Also try to make well labeled diagrams, flowcharts and cycles if possible. Wherever you use these, it will fetch you more marks. And try to leave space and lines between your writings, because if it is too crumbled, it will become khichdi and it won't be very clearly visible to the examiner. You will lose marks. So always leave space and lines and be spacious. Okay. Then it is also important that very of the students ask that filling pages will give you lot of marks or it will help us pass. So if you are only filling pages and there is no content or quality in your answers, it won't help you pass. Always remember, content and quality is more important than filling pages. Only in case of just a boundary number of marks, filling pages may help you pass. If you are getting 48%, 49%, then in case of emergency you can fill pages to try and pass. But if you are only filling pages, it will be very difficult to pass. Always remember, अगर पिक्चर में दम है, मूवी अच्छी है, कंटेंट है मूवी में, तभी वो पिक्चर चलती है. इन द सेम मैनर आपके पेपर में अगर कंटेंट और क्वालिटी है, तभी वो आपको पास कराने में हेल्प करेगा, नहीं तो डिफ़िकल्ट हो सकता है. सो कंटेंट एंड क्वालिटी ओवर फिलिंग पेजेस. Writing 40 pages out of 40 without content will not help you pass. Rather, 20 to 25 pages of good quality content will help you pass. Then, nobody likes to see boring movie. Same is the aspect of content in writing a theory paper. And last but not the least, always we have to try and add some clinical aspect of the topic, and it will help us remember the subject better and fetch us more marks. Then coming to the Viva. For Vivas, we have to always remember that it is the mercy of the examiner that we are going to pass. So always greet the examiner when you go towards the exam hall. Take a deep breath and do not panic. Whenever you are asked a question, take a 3-second break to think and form an answer in your mind, and then start speaking. It will help you speak better, clear, and give you more marks. If your answer is wrong as per the examiner, admit your mistake, say sorry, and wait for the other question by the examiner. It is final that never ever argue with examiner, because that is a sure secret to failing an exam. It will always be the mercy of the examiner that we pass by gradually increasing the difficulty of question being asked. So we have to always try to be humble, and if you get the opportunity of giving an answer, if you know the answer, give it. If you don't know, please accept that you don't know. And after giving some answers, it's a good way that if you cannot answer the other question, you may say that, sir, I had studied but I am unable to recollect. But that will only help you if you have answered some questions previously. Okay, so that is the simple secret of getting more marks in the Viva. And try to study well and discuss it with your friends, which is most important aspect in getting a clear pass in Viva, that you are able to explain the concept or the topic to someone and help him understand the concept. Then let's come to very important aspect of being a doctor and being a medical professional and medical student also, that is stress management. As exams will come near and you will have less and less time, stress will increase, and as you grow years by years, as you become a doctor, stress will come and it is going to increase over time. The added responsibilities of family, being a doctor, is going to increase. So it is very important to learn to manage and reduce its consequences so that it does not affect negatively on our health and performance. So we have seen that we have lost many doctors who could not handle stress and have gave up on life, and I don't want any other student or doctor to give up on life. So it's a humble request from my side to all students and doctors to work on their stress management skills. So there are various ways we can handle this stress. What are these? That could be like playing something, could be simple games like cricket, football, badminton, table tennis, etc. You can exercise at your home or workplace for some time, be it a jog or some form of yoga, anything. Then other way is to meditate by simply using some mantra or a good thought which you can repeat for some time, be it 5 to 10 minutes. It will help you reduce your stress and help you calm your mind and bring peace to your mind, bring clarity, and also help you understand the situation better. Other thing is trying to understand spirituality. It is one of the good ways and my personal favorite. That why are we here, what is the purpose of our life? Understanding this is the core concept of spirituality, and it will help us perform better in our life and as a professional. Other way is we can read some self-help books like Atomic Habits, How to Win Friends and Influence People, and many more. You can spend some time with your family. It's a very good option. Or if you are in a relation, try to maintain it and grow together, study and relax together. If you are not having one, please don't make one. I have succumbed twice in this relationship, so it's a difficult thing to come out of, because breakups are very difficult to cope up and we often land up in depression. So it's better to avoid, but it's like a two-edged sword. And वो लड्डू है जो खा रहा है वो भी पछता रहा है, जो नहीं खा रहा है वो भी पछता रहा है. Okay, so next point is spirituality, which is in my opinion is one of the best ways to manage stress, and it also helps to improve memory, focus, concentration and clarity of all subjects and life in general. So spirituality has personally helped me improve my memory, focus, concentration, clarity, and it has helped me clear my goals as early as possible, helping me get into MBBS in first attempt, getting into PG in first attempt. And it will also give us a big picture of life so that we can understand life better. And also it's my personal favorite, as I have told you earlier. You can start understanding spirituality by just reading any one of the books which you like Gita, Bible, Quran or some Buddhism book, and start it by reading just for 5 minutes daily and not more, specifically when you are starting studies. So before starting studies you can just read these books for 5 minutes, and or you can also do meditation on any God's name or form for 5 minutes. That will help you be more focused, improve your memory and concentration for your studies and exam. Also you can do anything among these, but please work on stress management skills, because the coming time you will have a lot of stress in your life, and if you are not able to cope up with it, if you are not able to manage your stress, it will negatively hamper you, hamper your life, and it can also cost lives. So please start working on them, and I hope you perform very well, and please feel free to connect with me and we can take things ahead after you clear your first MBBS exams. Thank you.